My name is Ross Atkinson. I'm the Strategy and Engagement Manager for the Applied Research Collaboration Greater Manchester. I work closely with all of our core operational management group in ArcGM to deliver a range of opportunities that are aimed at people working in the health and care system in Greater Manchester who are interested in doing some research. So welcome to our first question and answer session, which today focuses on internships and pre-doctoral fellowships for this next academic year. So for the intake starting in September 2026. Next slide, please. So as I mentioned, my name is Ross Atkinson. I also work closely with Dr. Penny Lewis, who's on the call today. Penny is the lead for research capacity development and also a senior clinical lecturer in pharmacy practice at the University of Manchester. Dr. Caroline Lear, who is the co-lead for research capacity development. Caroline works at Manchester Metropolitan University as a senior lecturer in mental health social work. Karishma Mistry, who is our ArcGM Research Capacity Development Coordinator, a really useful person to know. So Karishma will be a key point of contact. And also Rebecca McShane, who's not on the call today, I don't believe, but Rebecca is Strategy and Engagement Manager and Knowledge Mobilisation Lead also for ARC Greater Manchester. Next slide, please. So just to familiarise people with what the Applied Research Collaboration Greater Manchester is, it's part of the National Institute for Health and Care Research and it's classed as infrastructure funding. So our infrastructure funding funds people to be able to do research in the health and care systems. We're a collaboration between the health and care systems themselves, higher education institutions and the people of Greater Manchester, importantly. We support applied health and care research that responds to and meets the needs of the local population. And our overarching goal is to improve the health and care of the Greater Manchester population, the quality and sustainability of the health and social care that people receive. And ARC is one of several ARCs across England. Next slide, please. So as of the 1st of April, ArcGM updated our research themes. We're now funded to deliver some strategic aims across 6 research themes. More information is available in this slide here, and more information will become available on our ArcGM website as time progresses. If people do have more queries about what our themes entail, then please do contact Karishma or myself, and we can provide some more information. Research capacity development is one of our enabling strategies alongside patient and public involvement and engagement and research inclusion, knowledge mobilisation, and prioritising partnerships. Next slide, please. I just wanted to run through some of the eligibility criteria for people thinking about applying to our pre-doctoral fellowship and internship schemes. So these schemes are primarily delivered for graduates, excluding those qualified in medicine and dentistry who are working within organisations which provide or commission health or care services in Greater Manchester. So some of the professional backgrounds that are covered include nursing, midwifery, pharmacy, social work, social care, all of the allied health professionals, commissioners and policymakers. Just to note that people don't have to be employed within an NHS trust. They could be employed within local authorities or voluntary sector organisations, and some private care providers for those who provide care in the care sector, for example, care homes or domiciliary care providers. We do, however, exclude those who deliver private healthcare. If you do have questions about eligibility, then I would encourage you to drop me or Karishma a line. Our email addresses should be in the guidance that goes alongside these opportunities that people should reference, available on our website. Next slide, please. And I think at this point, I'm going to hand over to my colleague, Penny Lewis, who's going to describe the opportunities in a little bit more detail.
Thanks, Ross. So, hi everyone. So, I'm going to talk you through two of our programs today. I'm going to start with our internship program. So, these internships are really for those who want to dip their toe into research. You want to know a little bit more about it. Perhaps they've got an idea or a problem that they think might be able to be tackled by doing some research, and they want to make a network, and they don't really know necessarily where to start. This is ideal for you. And these internships really give you dedicated time, so 30 days, for you, which you can take flexibly over up to a year, to undertake and dip your toe into some of those issues. So this we will fund you £10,000 backfill that goes straight to your employer. So we don't fund you directly. That just pays for backfill for your role in your organisation. And you get a £2,000 training budget, which we will hold for you. And that budget will enable you to undertake any kind of research, any kind of training that you think will help support you develop your knowledge and your skills and your expertise in research. And that could be used for a conference as well. You will be supported by a supervisor from the ARC, and you don't need to find them. We will find them for you, and it depends on what it is you would like to get from the internship as to who we match you with. So it might be somebody that has, I don't know, a methodological experience that you want to develop. Perhaps you want to learn about how to explore the literature, and we could allocate you to somebody who works in perhaps evidence synthesis. Just to note, though, these opportunities are not necessarily for you to directly undertake your own project. So it's not that over those 30 days you work on your own idea. You actually are more about upskilling you to be able to take those ideas forward and making sure that they're feasible. So you're not actually going to necessarily be collecting data, but we upskill you to be able to do this in a robust way. Next slide, please. So the internship is structured around four key core components. So you get support from our research capacity development team, support from the research theme that you are embedded in. And like I said, we will match you with a supervisor who works within one of our ARC themes. You'll do your own individualized research activity. And there is some core learning that you will all get to undertake as part of a cohort, covering various different essential research skills. Next slide, please. So just to mention a bit more about that core training program. So at the moment we have 8 separate different standalone training options that you do. The first is what is applied health and care research, developing a research question, research ethics and good clinical practice, patient and public involvement, literature searching, how to read a paper, academic writing, presentation and poster skills, and then career paths in applied health and care research. So those are core training that everyone will undertake. And then there's more tailored training, which is based upon a skills audit. So when you first start an internship, your supervisor will run through a skills audit with you to identify what it is you'd like to get from the internship, and then identify what kind of training would support you in doing that. And that training could be potentially a master's level module, which you could undertake at the University of Manchester or any other higher education institution in Greater Manchester. Or you may audit only access that, which basically means you get to see the material but not actually do the assessment that's associated with it. But there's other courses that that you could take part in, that we can fund you to do, and they may be sort of a day course or a week course, really vary depending on what it is your needs are. All of our training resources will be accessible on Canvas, which is our online learning system. And you also, as an academy member of the NIHR, you get access to NIHR Learn, which has lots of resources to support you in your research development. Next slide, please. So in your application, what we really want to know is why you want to do the internship. What will it mean to you and your development? And in particular, what is it you want you want to be able to do at the end of the internship that you can't do now. And that is obviously very individual to yourself. It may be that you want to be able to network and make links with researchers that work in the area that you're interested in. It could be that you want to be able to search databases and not sure how to do that. You might want to develop a research question. You've got a problem, but you don't know how to kind of structure that into a formal research aim. We want to know how the internship will help you in your future career and your future career goals. So what is it you want to do next? And then just an insight into some training. And it doesn't have to be, fully worked up, but what kind of training do you think you might like to undertake as part of the internship? And again, that will help us direct your supervisor and get a feel for what it is you're trying to achieve. Next slide, please. Okay, so that's our internship program, and moving on to our pre-doctoral fellowship program. So these are for people who wish to go on to work up a PhD application for competitive funding, typically from the National Institute for Health and Research, because they have a doctoral program, but it could be from another PhD funder. So you want to already have a good, strong feeling that this is something that you want to do, and that'll be your next steps. And this pre-doctoral fellowship will give you the time to work up that competitive application. So you get £25,000 backfill funding, again, like the internship. That's not paid to you as an individual, but paid to your organisation to give you time away from your role. You will have a £2,000 training budget, which again you can use, and typically it's used for undertaking a formal master's level module, perhaps in things like research design, because that would directly kind of inform your application for your PhD. You can take it half time over 12 months. You can take it for 0.25 over 24 months, depending on what your needs are. This award also comes with a £1,000 patient and public involvement budget. So this allows you really to work with patients and the public to develop your research idea and research plans, which is really important for a competitive application for a PhD. So that's new for this year. Next slide, please. So pre-doctoral fellows also have access to the core training programme. It may be that some of those core training programme is something that they've already covered and they feel secure in that. But if they want to come to those, then they're more than welcome to utilise those. But they will also get tailored training opportunities by a £2,000 training bursary. So as I said, that could be a master's level module, but it could be other training that you need. And again, we can help support you and with your supervisors to identify where that training is best undertaken. And some of you at this level may have abstracts for submission for conferences, and you may wish to attend a conference in the area that you're interested in working in. Again, you've got access through Canvas to all of our training, and as an Academy member, access to NIHR Learn. Next slide, please. With the supervisory team for the pre-doctoral fellowship, you do need at least one supervisor to support you with your application. And you can have up to 3 academic supervisors. You need to identify who your main supervisor is and who your ARC supervisor is, and they could possibly be the same. You can have a supervisor from professional practice, and ultimately, if you are going for an NIHR doctoral fellowship, then somebody from professional practice would be great. But you can also use your pre-doctoral fellowship time to identify your final supervisory team. You at least need to come to this award with at least one supervisor and one from ARC, and it could be an objective of yours to work up that sort of final team as part of that year. So in terms of who makes a good academic supervisor, as a main academic supervisor, you would want somebody who's already had experience as a PhD supervisor, so they've actually supervised a PhD student before and they've actually completed their PhD. They need to obviously have some interest in your research area, or it may be they have interest in relevant methodologies. And typically when you go onto a PhD, you would expect that your research team and your supervisory team to be able to support you in all aspects of your methods. But again, that may not be fully worked up at this point. So if you have somebody that is really interested in the research topic itself, then you can work on identifying the wider team as part of the fellowship. You also need to think that you need to have that regular contact. You need somebody who has the time available to dedicate to your supervision over that year. And then at least one of your supervisors should be suitable to follow on to the PhD of a university of your choice. And that PhD does not have to be undertaken at the University of Manchester. It could be undertaken at another university. Next slide, please. In terms of finding your supervisors, many people at this point will already have somebody in mind that they've already worked with or know of their research. So it's always good to look in existing research papers to see who might be a good supervisor. But if you haven't got that in place, then please do contact the postgraduate tutor at the university where you would like to then go on and do your PhD at. And of course, you can contact us. So through Karishma, contact the research capacity team at the ARC, and we will help you. And we can particularly help you with finding an ARC-based supervisor as well. Next slide, please. So the 4 Ps for success is something just to reflect on when you're writing your application. We look for, and the NIHR look for these as sort of indicators of good applications. So we look at the person and how they are and their previous experience and motivations. We look at the place, so where you want to study, and your supervisory team, and what potential you have to go on to use research and research skills in your role. And then we look at the proposal, and this is in particular for the pre-doctoral in terms of your kind of research idea. Does this have sort of implications for patient benefit is a key one, and the future development of research in your particular area. Next slide, please. So what should you include in your application? Well, we want to know about your professional background and your interest in research, details of your supervisory support, so who you already have identified to support you. You can provide a Gantt chart. We want to know timelines. So if you don't want to do a Gantt chart, that's absolutely fine. But we just want to know kind of timelines over that year. How would that look? What would you do when? What training you'd like to undertake. So you could specify what courses or what master's modules you would like to do and the cost of those. I'd like to know a little bit about how you're going to spend your time. So what will you be doing? Will you be doing, I don't know, a scope and review of the literature? Will you be doing patient and public involvement? Will you be networking? So map that out across the year. And then how that work will contribute to the final kind of product of this PhD proposal, and at what point do you anticipate to submit that. We also need finance information, so you need to work with your finance department sooner rather than later to work out how much your time would be costed for undertaking this fellowship. Next slide, please. So we want you to think about, in terms of the pre-doctoral fellowship, how your PhD topic aligns with your career aspirations. How does it map onto the next stage in your career? For example, you may want to go on to be an advanced practitioner, and that doing this PhD will map well with that. You need to think about the benefits that fellowship would bring to your employer and organisation and the patients or service users that they work with. And then reflect on how your PhD topic would align with wider health and care policy and priorities. For example, how does it map to our ARC-GM themes, to the Greater Manchester Integrated Care Partnership Strategy, the NHS 10-year plan, or national research priorities such as those that are identified by the NIHR. You don't have to work through each of these, so it's not a long essay, but how you see it mapping onto at least one of these areas. Next slide, please. So please do read the guidance documents, which are available in advance of applying. The document does cover both the internships and the pre-doctoral fellowships. There is only one application form link for both opportunities, and you will be prompted to tick which one of those that you are applying for as part of that form. If you've got any questions, obviously in a moment we're going to open the floor to questions, but please email the ARC GM email or Karishma directly with any queries, and we're happy to talk you through any questions that you've got or thoughts. Next slide, please. So this slide here just really shows the comparison between the awards, because for some of these might be the first time that you've sort of learnt about these opportunities. So it's the same groups that are eligible for both. As I said, the internship is very entry level for those with little or no research experience, but with our pre-doc fellowships, we do expect you to have some knowledge of research and know that you want to go on to apply for a PhD. With the internships, they last up to a year, but with our pre-doctoral fellowships, you can do these over 2 years if you wish. The time commitment obviously is a lot less with the internship. It's 30 days taken flexibly. And as I said, it's up to half time over 1 year or 0.25 over 2 years for the pre-doctoral fellowship. Backfill £10,000 for the internship and £25,000 for the fellowship. The training budget is the same. For the interns, we will allocate you a supervisor, so you don't need to worry about that. With the pre-doctoral fellowships, you're responsible, but do please reach out to us if you are struggling with that element of the application. And the interviews are on the 1st or 2nd of July, and I think we've got a timeline in a moment. And both of those opportunities start at the start of the academic year, so you're aligned with various other sort of activities that go on within the university. Next slide, please. So this is the timeline. Obviously, we've got today's Q&A session. There is another one on the 2nd, so the 22nd of May. The application deadline is on the 1st of June, and you'll be informed of the shortlisting outcome on the week commencing the 22nd of June. Please hold these interview dates for the 1st and the 2nd of July. If you apply, those interviews will be online. And we'll let you know the week commencing the 30th of July as to whether you've been successful. And as I've said, the start date is the 7th of September. Next slide, please. Oh, that's it. So we welcome any questions from you on the call. If you want to, if you'd prefer to, sorry, you can put your hand up and Karishma will unmute you if you prefer just to speak. Bear in mind that you are being recorded. Or we can go over to, and we'll have a look at the chat as well. And there is some Q&A, so I'll just have a look.
Yeah, I think there is a couple of questions actually from one person in there, Penny. Do you want me to read those questions out? I can read them out.
Yeah.
In one go, and then we can address each of them separately as well. So first question is, could the supervisor team be from an existing research team within my institution? Second question is, I have some funded time to perform research at 0.6 full-time equivalent. This is recent and fixed term. Can this internship be undertaken at the same time as that? And what proportion is structured training versus gaining research skills in practice? So I suppose if we go to the first question, could the supervisor be from an existing research team within my institution? I'm happy to sort of answer that first one, if that's okay. Yeah, absolutely. Yeah, it would depend which organisation you work with. So what we would suggest is that we do want interns to have an ARC supervisor. That the way is to match our applicants with a supervisor who is already working within ARC GM. So if you work within an organisation, if you work with somebody that already is working with ARC GM in one of those themes, and you've already identified someone that you want to work with, absolutely that person could be your supervisor. If you work from an organisation, a local authority or a trust where you do have a link with somebody who could potentially be a supervisor but isn't working within ARC, I would suggest that mention that person in your application, but then we would also try and align you with an ARC GM supervisor. So at the very least, we need everyone who applies to our schemes to have a link with that somebody working within ArcGM. So again, bearing in mind that these opportunities are only available for people working within organisations that provide or commission health or care services in Greater Manchester. So higher education institutions, universities, people working within those organisations are not eligible to apply for these schemes unless they are also employed, maybe on a part-time basis, by an NHS trust or a local authority or a voluntary organisation. So hopefully that answers that first question. But if people do have questions that are not necessarily fully answered here, or there's some nuances, just get in touch with us and we can answer things on a more case-by-case basis when we know a little bit more about the context of where you're applying from. So the second question, Penny, is I have some time funded to perform research at 0.6. This is recent and fixed term. Can this internship be undertaken at the same time?
That's a tricky one. I think we'd have to have a conversation with your employer about that and how that would work in terms of backfill, because that sounds like a fixed term, contract. So perhaps that's something you could investigate, but reach out to us and we can have a conversation, perhaps one-to-one, about that and how that would work with your employer. I think that's probably what's needed.
Yeah, could I just add on to the end of that, Penny, as well, for people to bear in mind that people do need to be employed for the duration by that organisation who we will pay your backfill to. You do need to be employed by that organisation for the duration of that award. So we would probably want to ensure with your finance department, when you get sign off in terms of your costings, that you're going to have a contract with that organisation until at least the end of that award. So if it's the internship that you're applying for, if you say, I have a contract that lasts until June next year, and you must complete the internship by June, for example. We just need to make sure that, because the funding cannot be reimbursed to individuals, it's got to go back to that employing organisation. So we need to know that there's a contract in place with your employer. And that last question there, Penny, is what proportion is structured training versus gaining research skills in practice?
So currently there are 8 kind of core training sessions, but they're only typically sort of 2 hours long. And some of those, however, we do face to face. So we take an afternoon where we have sort of our peer support group as well. So there's those 8 sessions, and then the rest is research skills in practice, working potentially with your supervisor. It may be that they're working on a particular project that you could support them with. They may be doing some data extraction. It all depends on what your skills audit kind of reveals and what your learning needs are from the internship. But we will find activities that you can sort of work alongside within the ARC, so you get that exposure and that experience. So I'd say it'd be like a third probably would be sort of that more structured training, and the other 2/3 would be those research skills in sort of real practice, if you like. I hope that answers your question. Ross, is there anything you want to add to that?
No, that would be great. Thanks, Penny. There are quite a few questions coming through, and we're aware that there are also people with their hand up. We'll try and get through some of the questions that are in the chat, I think, and then we will come to people. But if you do want to react to any of those questions, or you have a comment, I think the chat is open as well. So I'll just go to the next question, if that's all right. Is someone currently undertaking an online MSc eligible for the internship? And the answer would depend on whether you're employed by one of those organisations that's specified in the eligibility criteria. So if you're employed by an NHS trust, a local authority, a voluntary organisation that's delivering or commissioning health or care services in Greater Manchester, then yes, you would be eligible, no matter whether you're doing the MSc online or not. So again, if there are nuances around that, please do come back to us, drop me an email or Karishma an email, and we can discuss that with you. Another question regarding whether this is an annual call. Up to now, so over the past 6 years, the ARC-GM has provided opportunities on an annual basis. This is the first call for our new ARC with our new research themes, and we do have funding to continue that over the next 5 years. So Penny, I think you'll probably agree with me that yes, there will be a
Yeah.
call. There may be some slight changes to eligibility criteria or the remit, but yes, we do anticipate that if people don't feel that it's right to apply this year, because we know that the time is short, then do consider it again for the future and come back to us in the meantime to really hone what you want to write in that application. We can try and provide some advice and guidance on that.
And if you let us know your email addresses, if you contact Krishma, we can add you to sort of our mailing list to let you know about opportunities when they arise as well. So do that. Okay. So next question, what advice do you have for applicants and their supporting institutions where the salary backfill does not cover the recommended whole-time working equivalent for the programme? Ross, do you have any? We've had this in the past, haven't
Yeah.
we?
Yeah, we recognise that just there are several issues around backfill, and we're happy to discuss these on again on an individual basis. We recognise number one that just providing backfill does not always mean that organisations are able to release their staff because sometimes staff are very specialist or there are not many staff around to provide backfill. And we also recognise that the £25,000 cap doesn't always cover up to 50% of people's salary. So what I would do in that case is you can negotiate with your organisation, and sometimes organisations are happy to try and help you find money to top that up from additional sources. Sometimes you may be able to reduce the level of commitment. So if, for example, you apply to do the pre-doctoral fellowship over 50% over 12 months, it may be that actually you only need to take 40%, in which case we can provide sort of tailored advice on what to write in your application for that. One thing that I would say about that is that the people who are reviewing your application will want to see that there is a sort of commensurate level of work with the time commitment. So the amount of work that you're doing in that fellowship would need to be achievable in that shortened time scale or that the reduced time commitment. But again, that sometimes people can find other different pots of money to top up that backfill. So again, do come back to us if you want to discuss more around that issue.
Okay, thanks, Ross. The next question, would it be acceptable to know the niche field you want to do a PhD in and using the pre-doc to find the exact gap in the literature and chalk out the research questions? I think that's a great use of the pre-doctoral fellowship time, is actually to determine exactly what you want your research question and aims to be. So yeah, absolutely. And you can do that in multiple ways. It may be that, as you said there, you want to do a type of literature search, could be a scoping review, or systematic review, and patient and public involvement engagement would be important to refining that research question. So absolutely. So when you apply for the pre-doc, we just need to know that you've got a general problem, an area or that you want to research, but actually we realize that you may not all have a research question, and that is part of your objectives for the year, and that's absolutely fine. But just set out what it is you're going to do in order to get to that sort of final research question for a doctoral application. So I hope that makes sense. But yeah, I think that would be absolutely fine. A question, the guidance mentions backfill funding paid to an employing organisation. I'm currently a Master of Public Health student, not yet employed by a health or care organisation. Am I eligible to apply now, or must I be employed by a partner organisation? So you must be employed by a health and care organisation or Commissioner of Health and Care within the Greater Manchester area. So unfortunately, you wouldn't be eligible to apply this at this point, but if you were to take up a post in a health and care organisation, then like we said, we will be doing these opportunities will be coming around each year, maybe slightly differently as Ross mentioned, but there will be opportunities that you'll be able to apply for in future years.
Penny, there's another question in the chat there. Can I just bring this one in? Because I think it's slightly relevant. It's around eligibility as well. Somebody has put in the chat that they're a microbiologist and they're currently working for a research and development organisation in Nigeria that is private. Am I eligible to apply for the internship programme or the pre-doctoral fellowship programme? And I think we're right in probably saying that, unfortunately, the opportunities are only available for those people who are working in organisations that provide or commission services, health or care services in Greater Manchester. So people would need to be employed by an organisation in the UK that is delivering or commissioning services in GM. So I think on that specific query, you wouldn't be eligible for these schemes. One of the things that we probably will do is try and also signpost to other opportunities that people might be eligible for. So if people don't feel as though they're eligible for this particular scheme, there are other schemes either provided by NIHR or other providers that we may be able to signpost you to. So I hope that answers that question there.
Great, thanks for us. There's a question about dentists not being eligible to apply, but holding a Bachelor of Oral and Dental Surgery from abroad, but not registered as a dentist in the UK, and transition to health and care research. I think with this kind of query, I think it's really what's relevant is your current role in the health and care system of Greater Manchester, and that is how we judge you rather than what your graduate degree is in. So if you work in public health in a health and care organisation in Greater Manchester, then you're eligible to apply. It doesn't matter that perhaps you may have studied medicine or dentistry. It's what your role is now. But if you're working in the capacity as a dentist or a medic, then that would mean that you are excluded from these opportunities. So I hope that makes sense. So a question about somebody's already applied for the pre-doc, but awaiting the outcome, fingers crossed for you. But could they use the same supervisors and added an ARC GM supervisor and apply for this? Yes, you can do. That's absolutely fine. I would expect research output as part of this pre-doc. I'm conscious that they would fund me less than 2 days a week. So again, it goes back to Ross's question about the time, like they're having that dedicated time and having a conversation with your employer about that, and what's achievable in that time that that backfill would pay for. So again, we could take that question offline and have a conversation. We'd be happy to have conversations such as this about what's feasible and whether or not there's any other opportunities or the organisation might be able to provide that additional funding for your time. So please do get in touch with us.
That probably links to the next question that's in the Q&A actually, Penny, around whether the pre-doctoral fellowship could be done in 0.2 timeframe over 1 year. And I think that would probably be, if I'm honest, that would probably be a stretch. So the amount of work, the amount of work in the pre-doctoral fellowship has to be a substantial amount of work that will get you to that next step to develop that competitive PhD application. So I would probably say that 1 day a week is probably not sufficient over 12 months. It may be over a longer period of time, over 2 years, but I think 1 day a week for over 12 months would not be sufficient, because people would reviewing the application would want to see that the application is a substantial piece of work that would need more time commitment.
Yeah, I think it would be a struggle to get that output of a doctoral application in that 1 day a week just for a year, but over 2 years it might be possible. Again, happy to have a conversation with you offline.
It's a question, a practical question about the form, which is a good one. So somebody has asked, does the form that's set up in Microsoft Forms, does this allow people to save as they go along, or should it be completed in one sitting? Also, is there an option to add in documents, or is it in typed format? So couple of queries there. I would say that the form, I think if you log into a system, it might allow you to save. One of the things that I would definitely do. Yes,
Sorry
Karishma,
to interrupt. I responded on the chat underneath the question, but yeah, I don't think, unfortunately, it's not a feature on MS Forms yet. So if you do exit the form, you do risk losing your progress, sorry, but we've circulated a PDF version of the question. So if you want me to resend that to you, I can. So I'd probably just advise doing it on a Word document first and then planning everything out and then transferring it into the MS form. But yeah, sorry about that. And then any documents you can email to me or the ArtGM inbox.
Absolutely, that's brilliant. Thank you, Krishma. And that probably goes without saying for a lot of applications that people put together. Even grant applications that are being put together by teams will often be worked on in sections on Word documents, old-fashioned, and then transferring that information into the online form, and also making sure that you've got enough time to do all that. So yeah, absolutely, I would suggest drafting everything in a Word document and then uploading it when you're ready to submit. Also, is there opportunity to add in documents? I don't think there is in this form that we're using, but we do encourage people, if you do want to submit a CV or you want to submit a Gantt chart, a timeline, then you can email those to the generic ArcGM email, which is available in the guidance, and those will be redacted, as will the application before it goes for review. So we take all the personal information off and just leave the information that's relevant to your application, and that will be reviewed alongside your application. And then I think we have another query. Are there any post-completion requirements for the pre-doc award? Are you expected to apply for a PhD within an agreed amount of time?
So no, we would like to know, it would be good to know what you're aiming for so we can sort of see what's feasible and what your ambitions are, and we can support you best when we know what your timelines are. But there isn't a stipulated amount of time, but ideally it would, so that your ideas don't go out of date. I would just generally advise that you follow this up over the next 2 years, because of how things kind of move quite quickly. But it wouldn't be that you have to apply within the next sort of X number of months, but we expect you to have thought through what works for you and the rationale for that timeline that you've set out for yourself. I think that's probably what I would like to see. The next question, would there be any publications expected? Well, again, we don't expect you to have publications, but publications are absolutely extremely valuable for your PhD applications, if that's what you're applying to do next. So if you are able to publish, and we've had great success with our previous pre-doctoral fellows and even interns have gone on to publish the work that they've done, and you can see examples of that on our website as well. So yeah, for your own development, fantastic if you can get a publication, and we do sort of expose you to that if that's something that you are interested in doing. And again, we do provide support for things like writing and searching literature if you're going to do a type of literature review, for example. Okay. Next question. I finished my bachelor degree in psychology. I'm working as a medical secretary in the NHS. Am I eligible to apply for the programme? So working in the NHS and you're a graduate, then yes, you're eligible. I suppose with this, it would be that your programme of work or your ideas, you need to kind of relate that to your actual setting. And we've had Ross, we've had success from support from administration before in one of our programs, haven't we? So absolutely.
Yeah, absolutely. Yeah, so people who have worked in transformation teams and improvement departments within NHS Trust, for example, have completed the pre-doctoral fellowship. One of the things that I would echo that Penny has already said is reflect on how that would sit within your current role. And because one of the things that you will have to do as part of this whole process is describe to your employer what benefit you are bringing to the organisation and why they should allow you to take that time. So really think carefully about that role that you're currently in and what benefit you doing the internship would bring to that job role. That may be the most difficult part of that application in terms of trying to convince the people who manage the service that you work within to allow you to apply for this scheme. Not allow you, but provide that additional bit of support, because they will need to sign off your application to apply for the scheme.
Yeah, great. So I hope that helps. And then are people working in mental health services eligible to apply for the internship? Yep. As long as those mental health services are commissioned or funded by the NHS, then yeah, that is absolutely fine. We would welcome your application. And we have got a quite, sorry, someone's hand up, and apologies, your hand's been up for quite some time. Apologies for that. Can we unmute Karishma so we could allow I don't think I can unmute, but if you've got your hand up there, I can't see your name. Oh, is it Billa? Billa, do you want to unmute yourself, and we'll happily answer your question if you've got one. No? I don't know whether Billa's there.
It may be the settings that need to be adjusted.
If you want to write your question in the chat, Billa, sorry, apologies if you're unable to unmute yourself, please do use the chat function. Does anybody else have their hand up, or are there any other questions?
So we do have a question in the chat, actually, in the chat rather than the Q&A. As a part-time member of staff in the NHS, instead of getting backfill, could I be paid with the funding to work extra by my employer? So that's a good question. I think it's something that comes through quite often. We have to pay the backfill money to your employing organisation. So it may be that if you work part-time currently, it may be that you can adjust your contract with your employer, as long as you've got an agreement with your employer as to how the funding would work in practice, and that may be around you increasing the number of hours that you are contracted to do, but on the agreement that some of that time is taken for research, that may be an option. So what I would suggest is discuss that with your employer, with your managers, and write that solution, that suggestion into your application so that we can clearly see how things would work in practice. But just to echo, like I said before, the money has to be paid to your employer, cannot be paid to individuals. So we would have to make sure that there's a process by which we can ensure that the employing organisation gets that funding.
Thanks, Ross.
There's one more in the Q&A as well.
Thank you, Krish. Let's have a look. Do previous fellowship holders have a successful track record in getting the NIHR doctoral PhD award, and is additional support available for the same? So in terms of the first point that you've made, question, yes, we've had fantastic success with our previous pre-docs going on to secure PhD funding through the NIHR, but also through other funding through the Forward North scheme as well. So we feel like we have got a good track record, which is great to see. We've had interns that go on to become pre-doctoral fellows who have then gone on to apply for PhD funding as well. So we can see that success, which is great. I'm not sure about your second point. I don't know. And is additional support available for the same? I'm not quite sure if I understand the second part of that question.
What we do try and do to everyone who even applies to our schemes, as well as those who are successful, is we try and provide at least some feedback on people's applications. We don't want to just turn people away and never see them again. We do have people who have applied again the following year and been successful on internship or pre-doctoral fellowship schemes. So it is highly competitive. Our local opportunities in Greater Manchester and those of the other ARCs and all the other parts of the NIHR infrastructure are competitive. The national opportunities are also very competitive. And what we would try and do is provide feedback, but also support, for example, workshops of people who are on our internship programme who want to apply for the pre-doctoral fellowship. We'll really try and work with you to help you develop that next step. So we do provide people tailored support wherever we can, however time allows. And we have had events, group events, whereby people will come along and sort of learn about how to develop their next steps. So it depends on the individual scheme that you're applying to depends on what your next steps are, but we do try and provide as much support as we can.
Yeah.
And also, as I mentioned earlier on, there are other opportunities that we could potentially signpost to. If people think that our scheme is not the one for them, or if there's they don't have the time to apply for this particular round, you can always come back to us next year and see what opportunities we've got. We will have some opportunities available. Usually they open in the spring, but also there are other organisations supported, funded by NIHR, such as R&D Northwest, who provide a health and care professionals internship scheme. The eligibility is slightly different. It's a very similar programme, but I would also encourage people to look at those opportunities as well, just to see which award might be the best one for them.
Yeah, thank you. And I think there's a question in the chat. Are there any opportunities for PhD funding coming up under the ARC-GM? So there may well be some PhD opportunities, but these will be sort of predefined projects as opposed to projects that individuals work up for themselves, and they'll be aligned to our current themes. So yes, but it's still early days for those particular PhD fellowships, and they are different to the doctoral fellowships that NIHR offer in terms of backfill. So these will be stipend funded PhDs that we will hope to be able to offer. Okay, I'm just going to go back to the Q&A, see if there's any questions in there. Oh, thank you for the clarification, Norpreet. So, yeah, support and sense of advice from previous, figuring out how ideas fall within the remit. No, don't apologise for the question. That's, yeah, absolutely. And I think Ross kind of responded to that there, that we will support you. And we've done a little workshop in the last round. We did a workshop for those who were applying for grants, where we covered what funders look for. We do mock interviews because we know that that's really important. A lot rests on those interviews that you have to do for the particularly for the NIHR pre-doctoral doctoral fellowships. So we do offer that kind of support. And yes, and in some of the workshops we bring back our previous award holders who can talk to you about their experiences of what it's like, and their applications as well, where they're happy to share that information. So yeah, it's a bit of a sense of a community that you get from joining these programs. And one thing I don't think we picked up in the presentation is that as part of this process, you do sort of join a cohort of fellow interns and pre-docs, and you get to meet with them regularly, facilitated by one of us in the ARC. But it's really about learning from each other and having that network and that support, particularly when, you know, this is new and you're not sure. And it's, you know, if you've got any kind of questions that you can find, that speaking to sort of people who are doing similar activities is really, really helpful. So that's something that we do as part of the ARC internship and pre-doctoral fellowship. So I hope that answers your question, Norpreet.
Yeah, and we're more than happy to link people up with people who've been through the whole process, so you can have an informal one-to-one chat with people, really. And I think that's a really good point that you also make around figuring out the ideas, whether they fall within remit. So again, something that we probably didn't dwell on at the start of this webinar, but the applied research collaboration is very much about applied research that can make a difference in practice, either in the NHS, in local authorities, social care, public health settings. But when we're looking for people who can do applied research, and that may have a patient or user or a client focus, or it may have a staff focus. We do research that's sort of across the board, has impact on the health and care system. We don't do biomedical research or heavily clinical research. Again, just going back to what I said before about the other parts of the NIHR infrastructure, if people think, I'm not sure whether my ideas fit with the ARC or whether it's something that is too biomedical, come to us and we can discuss that, and we can signpost people to the other parts of the infrastructure that might be able to support better.
Yeah, we do link in with the Biomedical Research Centre and the Patient Safety Research Collaboration. So we've got a network. So if we think that your idea doesn't fit with us, we won't just say no, no, we will go, we think these are the people that you need to speak with, and make those introductions. So it's coming up to the end of the session. We have a minute left. If there's any questions, any further questions you've got, please let us know.
I think what we'll do after the webinar is actually we'll gather all of the questions that have come through to us, and we'll provide a bit of a written summary of the answers on our website. So we'll have a little bit of a frequently asked questions guide available on the website. The recording will be available on the website for people to review, or if people have not been able to attend today, that will be available. We do have another Q&A session that people can come to again if you want a recap, or if people want to come to us with specific questions that have not been asked or answered on the call today. If you do email us using those email addresses in the guidance, and we will get back to you and try and provide a little bit more tailored guidance.
Great. Okay. Well, thank you everyone for coming today. I look forward to speaking to some of you again, and yeah, as Ross said, please reach out to us if we can be of any help to you. Thank you.
Thanks very much, everyone.
Have a good afternoon.